and welcome to our dialogue on impact of COVID-19 and our stakeholders meeting. I'm really delighted to be hosting together with my team today this meeting, which is necessary, important and crucial for all of our work going forward on the issue of violence against women. But before we start, I really want to express my hope that everybody, all of you and your families are well and safe. All of our good wishes and thoughts are with everyone who is experiencing any hardship at the moment due to the virus itself or because of any other subsequent consequences or life-driven situations. So please accept all of our warm wishes from all the UN Trust Fund team. And before we go into the meeting, just a few housekeeping items. So you will all notice that you have all been muted to avoid audio issues. But please type your questions or comments in the chat box, and please type your name, your organization, type of organization. If you wish to say something during the open discussion segment of the meeting, Gemma, my colleague Gemma Wood, who will be moderating the whole open questions discussion session, she'll be reviewing the chats together with other colleagues from the team. So please make sure that you have put all the information there. There's a code of conduct for this meeting that you have all received yesterday. Please review it, which will give you some ideas and tips of what we expect in terms of behavior, in terms of how we are going to moderating the event. So I'm going to move straight into the objectives of the meeting and why are we here. Just to let you know that this morning we had 334 registered participants for this meeting. Right now in this room, we have in our virtual room, we have 185 participants and they keep joining us as I speak. We all know that this subject in our work are very important, but just the pure numbers that are joining this conversation today are showing us how important this subject is right now in this moment of the pandemic. And it is a clear indication of importance of our work today and going forward. So why are we here today? We're here today to directly hear from civil society, women's rights organizations and partners on the impact of the COVID-19 pandemic on their organizations, beneficiaries, and as well on the rise of the violence against women and girls in the current context. We are here to discuss how we can mitigate these risks and impact of the pandemic to best support women and girls in need and the first responders, particularly small women's organizations. We are here today to inform you all of what steps we are taking to address the impact of COVID-19 on our own grantees, as well as going forward on a broader issue of violence against women and girls. Very shortly, you will hear about our 5-point action plan that we are launching today in terms of the direct support to our all current grantees. And a bit later, at the end, I will speak about some of our plans, thinking and preparations for the longer term solutions and options. I will stop here because I know that my team has a lot to take you through today. I will hand over to Tanya and other team members who will take us through this meeting with an aim to learn from all of our partners on the ground and to discuss the needs and challenges and opportunities. At the end of this program, we will open the floor for questions and comments from all participants. But please note, we don't have all the answers. We are all here today to listen and learn about this extraordinary circumstances, situation, and what we can do and how we can do it to help women's organizations, women and girls, beneficiaries, survivors, and what we can do together. As one organization, we don't have the all answers, but we know that together, going forward, we can find many of those answers. So Tanya, over to you.
Great, thank you very much, Aljana. Good morning, good afternoon, good evening, colleagues. We will shortly hear from 3 UN Trust Fund grantees that are working across 3 continents in countries with varying degrees of spread of and impact due to the coronavirus pandemic. We have Maliha from Bosnia, who's working with survivors of intimate partner violence, Gaudence from Rwanda, working with women and girls with disabilities, and Rashmi from India, working with women burn survivors. And we will have an opportunity to listen to their experiences, as well as many common challenges and the measures that they are taking to cope, adjust, and adapt to the crisis in their communities and their contexts. But before I turn to the first speaker, I wanted to briefly share an overview of the UN Trust Fund's existing grant portfolio. We are currently working with 144 organizations in 69 countries on projects that are at various stages of implementation, with a smaller group waiting evaluations or operational closure. As you would see, almost 60% of our partner organizations are self-identified women's rights organizations. Around 13% are human rights organizations, and the remaining primarily self-identify as disabled people's organizations, development organizations, international NGOs, and faith-based organizations. A little more than a third of our grantees are based in Africa. The next largest set of grantees is in Latin America and the Caribbean, followed by Asia Pacific, Europe and Central Asia, and finally the Arab states and North Africa. Now, due to the complexity of this 2-hour session, we were only able to conduct it in English. However, I did want to flag that we will have a separate session for our Spanish-speaking Latin American colleagues, as well as one for our Francophone grantees over the course of the next week or two. So with that, I would like to introduce our first speaker. Maliha Sindik is the president of Center of Women's Rights in Bosnia and Herzegovina. The Center of Women's Rights is a small women-led organization that was established almost 25 years ago. It was established as an immediate response to assist women in the post-conflict period. And since then, it has been providing free legal assistance to women, primarily to women survivors and those exposed to greater risks of violence. Now, as the curfew and lockdown measures immobilize the country, Maliha will share with us the situation of the women and girl beneficiaries that her organization serves. Her statement will be read by Selma Badzik, who's the program assistant for the organization. Selma, over to you and Maliha.
Thank you, Tanya. Good afternoon, everyone, dear colleagues, friends, and sisters in solidarity. We are very, very happy to have the opportunity to participate in this meeting and to refer to you.
I predstavimo ono što smo mi pokušali u ovom vremenu da uradimo i da reorganizujemo naše aktivnosti u ovakvom teškom vremenu.
And also to speak about how we have reorganized our activities and to present the situation in this short period of time that we are given with. Okay. Once again, thank you, Tanya, for introducing and presenting our organizational work. And I will now proceed to delivering the speech about COVID-19 pandemic, which has imposed additional burden for women in Bosnia and Herzegovina. And here is why. Since the outbreak, the government has put social distancing and movement restriction measures such as the lockdown and curfew from 8 p.m. to 5 a.m. Courts are not working. Jurisdiction of larger centers for social work in their shortened working hours has already been redirected to delivering social aid packages. Police structures are primarily engaged in monitoring the measures of the isolation and also the monitoring of the violation of the curfew. And there is only one prosecutor on duty. For women, that means that they have to stay in home with the violent partner. And that is especially concerning in cases where divorce proceedings are already initiated. Court's decision on divorce and custody on children are not respected. Centers for social work and police are not doing their job in issuing, reporting and monitoring the respectful of issued protection measures, such as the prohibition of women, such as prohibition of approach to the victim of violence. There is no on-duty service officers within these institutions to whom women survivors or those exposed to violence could turn for help. There is no one that monitors what happens after the dark, nor reacts. Long-standing institutional issues, which we are pointing out for years now, are now becoming more and more obvious. An example is a call for help that came 2 hours after the curfew started. It's about a woman who is divorced and now living in extramarital community with her ex-husband and 2 underage children, one of age 15 and another 10. The violence happens at the cottage, which is 45 to 50 kilometers away from the city. And what is more disturbing is that the violence happens in front of their children. When women called the police, the police officer told her that they would not bring him in, nor will they impose the urgent protective measure of prohibition of approach to the victim of violence, because the reason was they are not longer married. He threw the woman around the room, pulled her by her hair, and ripped out a strand of her hair. And when her elder son saw that, he stood up to defend his mother and punched his father, the abuser, in his face. Then the woman, together with both of sons, fled out the cottage and locked the abuser inside the cottage. They stood just in slippers and t-shirts in front of the cottage for approximately 1 hour until one first neighbor saw them and offered to let them in their house. Then the woman, we contacted the women, and if we didn't intervene and provided women with guidance, what to do, what to tell to police officers, we are afraid that this report of violence could have gone off the radar, and maybe it could have ended in a fatal outcome. And that is mainly because of the insensitivity and ignorance of the police officer who received the call. What is important in this case is to emphasize that a lawyer, together with a therapist, were talking to the victim, and together they encouraged the victim to report the violence, and this case is ongoing. Illustration of how the situation is severe and dire is a simple comparison of data before and after the outbreak of COVID-19. 48% of women who turned to us before the COVID-19 outbreak were experiencing psychological violence and physical in amount of 11%. Now the levels of psychological and physical violence are even. In order to deal with the crisis and to continue helping women and girls, survivors of violence, and those still exposed to violence and at risk, and still keeping our staff members safe, we have put the following measures in place. By putting pressure on city administration, we achieved to introduce the free phone line for legal aid and psychological support for all women victims of violence and for all other forms of violence. The phone line is available each day from 8 a.m. to midnight. The whole center team is available for all kinds of legal counseling and other kinds of support. Due to the severity of problem with which women are facing with, we engage 2 therapists for psychological support who work on voluntary basis. They have worked with women during and after the wartime period in Bosnia and Herzegovina, and they have extended their work expertise to other traumatic experiences, such as domestic violence. The first contact is made by on-duty members of the center by answering calls or messages via social networks or via Viber or Messenger. After that, based on the assessment of the on-duty member of the center at the office, they connect the client with a therapist. In order for women who do not have their own income, do not have money on their phone account or access to the internet, to react, report violence, and seek help and support, it was necessary to introduce this kind of free phone line. This reduces the risk of escalation of violence and complaints by the husbands and partners, such as who are you talking to, and stop spending my money on the phone. The free phone is being promoted by city administration on all media portals, radio stations, and we have spread the news on other portals in Bosnia and Herzegovina. We would not be able to provide this within our capacity and in this intensity. In addition to the free phone line, 2 other phone lines are available for all women, and previously established online legal support for women and children via the link on the website of the center, which enables women, regardless of their place of residence, to contact us for help, and they get answers as quickly as possible depending on the circumstances. There are also advantages of some kind of work, such as specialized distance learning program, which in practice, although it is practice that most activities are delayed, our organization continues without obstacles and downtime with a distance learning program, which is aimed at educating police officers in Sarajevo, one of the cantons in Bosnia and Herzegovina. This distance learning training program was developed 5 years ago and has so far shown tremendous advantages over conventional learning methods, especially in situations where trainees cannot be absent from work and when other constraints such this crisis situation exists. We as service provider, however, are facing new issue. The staff is not paid extra for extended working hours due to the lack of support, and we do not have additional projects nor donations. Projects that were approved by different government levels are now being postponed or cut off in total and redirected to healthcare institutions. We are doing our mission in our own capacities and with what we have. We cannot leave women behind and alone. 10 minutes is really short time for you to understand and to experience the stories of our women, the way we relive them every day, which keeps us from not giving up on them. As a conclusion, we hope that what we have put in place can help and inspire other organizations dealing with similar issues. Still, one question remains. What will happen after the COVID-19 ends? Since the beginning of this crisis, we have been approached by different independent researchers, donor organizations, with questions about the situation in the country about COVID-19 pandemic and how the position of women is now in Bosnia and Herzegovina. However, such questionnaires do not provide an opportunity to talk about real lives and stories of women and the problems with which they are facing with, from the reluctance of the institutions to avoidance to fulfilling their statutory authority to protect them from abusers and others. It will not present a realistic picture, and thus it will not properly lay the groundwork for eliminating perceived shortcomings in the system of protection of women against violence, which we have been pointing out for years. COVID-19 will pass, but will anything change in the protection system? Thank you. That would be in short. We hope that we didn't breach the given time. And we are at your disposal for any additional questions, clarifications. We would be glad to answer them.
Thank you so much, Salma and Maliha. Our next speaker is Gaudence Mishimijimana, the Executive Director of UNABU Rwanda. The Rwandan Organization of Women with Disabilities was created in 2004 and is led and managed by girls and women with disabilities for girls and women with disabilities. It is currently implementing a project to reduce economic and social violence in 5 districts in Rwanda with support from the UN Trust Fund. So Gaudence will share with us some challenges that UNABU is facing to organizational stability and continued operations in the context of COVID-19, as well as UNABU's concerns regarding the potential impact of the spread of COVID-19 on primary project beneficiaries, especially those in rural areas. So thank you very much, Gaudence, and over to you.
Hello.
Yes.
Are you hearing me?
Yes, we can hear you.
Okay, thank you. This is Gauden speaking from One Organization of Women with Disabilities. As far as the situation is concerned, organization is quite small. It's a small membership organization of girls and women with disabilities, and of course we support girls and women with disabilities. We are currently having like 11 staff, dominated by girls and women with disabilities, of course. But also we promote community activism whereby we are working with around 200 girls and women with disability volunteers at the community level, supporting the girls and women with disabilities organized into what we call advocacy groups. As far as the situation is concerned, like many other organizations, we are facing some challenges to adapt to the situation. But some of the times that we are facing following the closing of the offices according to the government measures, we of course we stopped all the field project activities. Why all our activities are field-based because girls and women that we are working with are based at the field in remote rural districts where it may even physically not accessible to access. And then we are like facing some threats that are out of our control. We foreseen the future challenge about fundraising because this is the pandemic is economically affecting the global fundraising opportunities. And of course, it will be difficult for small organizations like ours to compete with bigger organization after the situation, going through competitive process regarding our network, regarding experience, regarding technical and institutional capacity. We started foreseeing the challenge really to access new funding, new donors to continue our work of supporting girls and women with disabilities. But also,
Gaudence, sorry to interrupt, but is it possible for you to come maybe a little closer to the speaker? Some participants are saying they cannot hear you very clearly.
Oh, I'm sorry. Is now okay?
Yes, that's slightly better. Yes, thank you. Gaudence, I think we lost you. We can't hear you at all right now.
100%. I was saying that, let me bring the tool closer. I was saying that we are also facing or seeing the challenge in relation to stability and sustainability of organizations. Is that okay now?
Yes,
Hello?
that's slightly better. Thank you.
Okay. In terms of sustainability, we are 100% depending on external donations and funding. Why we don't have like reserve funding to make sure that after the situation we be able to continue our work, paying staff, and even continuing our field intervention as far as the situation is ending. We are concerned about the spread of the COVID-19 to our beneficiaries, girls and women with disabilities, because we all know that women and girls are the most vulnerable in all the situations. Why? Because due to the multiple discrimination, those girls and women with disabilities, they are facing so many barriers. Most of them have never been in school to be able easily to read the messages and information about the pandemic. But also the current way the information is spread out. We use TV, national TV. We use also mobile phone, the means of care used to send out the message using the mobile phone. But also the other channel is radio. information, and most of the girls and women with disabilities have no access to all those communication tools to be able to access information. So they are really at higher risk of being affected by the pandemic because they are lacking information. But also, we started collecting information about the risk of more violence than it was before, because like some of the cases that we receive, some girls and women with disability are living alone in their houses, and they depend 100% on the family members and even the neighbors. But for now, those who live alone, it's really, really very difficult to survive when they are supposed to be staying home, and some of them, they have severe disabilities. They were supported by their neighbors. As their neighbors are staying home, then they are lacking the support from their neighbors. But also they were reporting the fear and insecurity of sexual violence, because when everyone is in his or her home, then the movement around them is reduced, distracted, and then they are saying perpetrator may take advantage of being alone in their home and no one is moving around. This is really a threat for girls and women with disability, mostly living alone in their homes. But also, we started seeing like issues raising around the lack of the basic products, the basic meeting their basic needs. The most coming out is about products for they lack sexual reproductive health information, but also the products for managing their periods, because some of them, they have been depending on their family members, on their church members, and now there is no opportunity to interact, also to be visited, to get all those supports. Those are also the issues that are coming out, but also the lack of food. We all know that food is basic. You stay home, yes, but when you don't have food, then this is also the challenge for most of girls and women with disabilities. And this is also multiplied with the current persisting negative attitude perception. When there is a need, the need of girls and women with disabilities in the family are not given priority. And this is a challenge, and this is also violence in terms of accessing their families' property, their families' housing. Let me say that we also identified some cases where girls and women with disabilities, especially those who need regular support like medical meetings, doctors, they are not really able to access health care. Those with mental, intellectual disabilities, some of them, they need regular check-in, regular medicine, and now it's difficult for them really to access those services, and this contributes to increasing even their degree of disability, especially those who need medicine because of their mental disabilities. Although the situation, we have some measures in place. Of course, we respect the government guidelines, stay home and work home. With our staff, we have regular check-in calls through phone, but also we have one meeting for all staff online to make sure that not only for monitoring the performance, but also checking in terms of health, because we know also this is challenging for them. Like, for example, most of our staff don't have their own car, so going out for shopping, accessing the health services when they need, this is also challenging, and this is the reason we make sure that every week we check in with everyone to ensure that how healthy are they, whether they need any support, so that we can know what is happening in their families. On the other side of beneficiaries, The first step that we took is understanding the situation. So we are currently running quick assessments to understand the situation. How are they managing the situation? Are they accessing information? What is the impact now affecting their life? To ensure that after understanding the situation, then we can come up with advocacy direction for our government, for even other stakeholders, because in our country, for now, it's like everything is turned to COVID, nothing else. So even when we see our civil society organizations, they are not really well engaged in that situation. We are all relying on government in everything. So we need to understand the situation with the assessment so that we come up with what we really can do. And this will also help us to respond to the requests from our donors. How can we adjust our current program? We need to adjust, but based on what are the needs, what are the issues that we are seeing from the field. Of course, we run the phone interviews, and most of them, they don't have mobile phone, and it's risky for volunteers because volunteers are going home to home, although we give them information, but they don't have even protection equipment. They have information, but they don't have protection equipment. But we are trying to run the assessment for around 300 girls and women with disability across our geographical coverage. And by the next week, we will come up with a report so that we can know what to do next.
Great. Thank you very much, Gaudence. We need to now move on to the other speaker. So do you want to just maybe very quickly wrap up in the next 30 seconds or a minute?
The only thing that I want to talk about is the limitation and the gaps linked to the technology and the skills. Even though we are supposed to be running everything online, we are lacking the facilities, both phones, and the skills to manage a meeting online. We're thinking like having stakeholders training online, but with those limitations of technology, knowledge, skills, we are not really performing as well. But also the need of beneficiaries in terms of food, basic needs, we are not able. But what we do, we communicate with local authorities to make sure that whatever case comes out, we refer to the local authority for urgent support. Thank you.
Thank you so much, Gaudence. Our next speaker is Ms. Rashmi Singh. She's the Executive Director of Programs for the International Foundation for Crime Prevention and Victim Care in India. PCVC works with women impacted by burns due to domestic violence or violence due to burns, and facilitates the process of reintegration into families and societies at large. Rashmi will share her insights on how the current pandemic is impacting women and girls that PCVC supports, the heightened risks of women and girls in the context of the pandemic, as well as issues and challenges faced by the PCVC staff, among others. Dear Rashmi, thank you for being here today, and the floor is yours.
Thanks, Tanya, and thanks everyone. So I won't take much time in introducing myself and the organization, but quickly I'll share that we give comprehensive support services to women survivors who are particularly burn survivors, other domestic violence survivors, and individuals who are from the LGBTQI community. So quickly, this whole sharing is into two parts. One is I will just take everyone through what's the scenario and what we are learning from it, and also what is it telling us. And then the second part of my sharing is more around what we are doing at the moment. So quickly getting into what's happening. So this happening and how we got to know, it started with when the lockdown was declared in India by the Prime Minister on around 27 March. And that was the first lockdown for 21 days. And we quickly got our acts together and we started working, okay, how's everyone going to work in the team? People who are working in the field, in the hospital, they are not going to be going to the hospital. What's the infrastructure required? All that we started doing. So it was more about logistics. And then we started, when the senior management team, when we were having conversations after like a week, and then this news started coming from all over the world that in the situation of COVID-19, even the domestic violence has increased. And it is because of the lockdown and with women being inside homes along with the abusers. So we were like, okay, what do we do about it? And then we started talking of, okay, when the lockdown will be lifted, then that means there are going to be more cases which will come to us. And while we were having a conversation, one of our women colleague who's there as one of the responders, she said, hey, I want to bring your attention to that in the last 1 week, we've just had like 4-5 calls. And initially, like, I mean, all these days before this COVID outbreak, we used to have almost like 10 to 12 calls, 15 calls in a day. And that she just brought to our notice that actually it is just 4-5 calls. And why we are going and, spreading awareness, because nobody is calling. So we said, okay, then what could be the reason? So we started thinking about and talking to a couple of others. We realized that what could be the reason was that everyone is at home. So she's not having the space to talk. The other was also about that there is too much of workload and that's not her priority at the moment. And of course, there is less physical and mental space. So we said, still doesn't matter. We will go ahead with like really upfront going and publicizing our hotline number. And at least people come to know, because what also happened was that when the government declared that the only essential services would be available during the lockdown, I think, and this is again from our own understanding, that we thought that actually the message which has gone is how essential services is understood. So essential services largely means food, water, that's all. And even for women, it was like, okay, even if I'm going through abuse, I know no NGO would be working because that's not an essential service. So that's why maybe women were not calling. So we had no idea. So what we did was that we said, okay, just let's go out and start advertising and putting our helpline number all over. Of course, we do that around the year in a normal development, long-term development program, but we really went out and started doing. Within like 10-15 days, the number of women reaching out to increased almost 3 times. And we were like, okay, why this could have happened? And then we started looking at the patterns. And when we advertise the number, we very consciously advertise that we are available on our Google chat and WhatsApp chats as well. And then we saw that in a day, around 8 to 10 women started reaching out to us. And out of them, 50 to 60% were on chats. And that too, because we have a 24/7 helpline. And most of the women were reaching out to us through WhatsApp. And the reason the women were telling were that that's the time when the husband or the family has gone off to sleep, or everyone is busy watching TikTok videos. So other people also think that's what I am also doing. And that's the time I can't talk. So chat is better. So the number of calls, they increased. And at the moment, so what we started doing was that, of course, psychosocial counseling is immediate. The key message which is going at the moment was, okay, we are there, talk. The shelter is there because we have our own undisclosed shelter. We offered that to women. If you are in threat, then it is there. And if she is calling from some other city, from other location, then we already have like a robust referral system where we were trying to connect with her. But what we learned during this time is that even the number of women and the women who are calling us, they are not in a situation or in that decision making to step out and come out for counseling. But definitely they want somebody is there who they can talk to. Because the amount of stress which is building up, and these were the women, these are some of the first time callers. So we don't know that they have a history of violence only when they are talking to us. So this is I'm talking about the group of domestic violence survivors. Now, one particular group with which we work, and that's the project which is supported by the UNTF, is our Burns project. Now, in the Burns project, we work in the 11 hospitals. What we saw and what was the pattern there is that the number of women in the Burns ward has reduced. So then we were talking to and how we are tracking that, because our field staff is not going to the hospital because the mobility is not possible at the moment, and we are making sure that our staff is safe. So we, just try to understand, okay, why is the burns have reduced, the incidents have reduced, or what is it? So when we spoke to the doctors, they said no, and even the field coordinator said no, we don't think that the incidents have reduced, but it is basically the hospitals are taking only the serious cases now, because everyone's attention is to dealing with COVID. And in a lot of our hospitals, the burns wards have been converted into COVID wards. So only when it is a serious case. So this is alarming for us, because women who have gone back, the mortality rate is going to go up, and then the infection is going to go high. So we are really worried. But at this point of time, the only thing is we are trying to maintain a very robust database of those people, because we have good relationship with at least a few hospitals who will be willing to give us the data. Anyway, after that, our team is permanently stationed in these hospitals. So this has been something. Now then we started looking at, okay, what is this pattern of violence like? What kind of violence when we started getting the calls? So one is, of course, there is a lot of disrespectful behavior by the man to the women, because the entire family is there. So abusing her for cooking, abusing her for not having food, humiliating her. And of course, as we all know that economic stress is one of the reasons which perpetrates violence, and men are in economic stress, because all of them are losing their jobs, and the manifestation of that is violence. So that's one of the reasons which has been coming. The other is when there was complete lockdown, we got a couple of cases where there were cases of sexual assault and sexual violence as well by other relatives, because the house is closed, people are staying together, and nobody wants to talk about it. So that was one. The other thing was, like today only I was reading the report, one of the report which has just come in India, and it is talking about that the violence inside homes has increased, but it is a non-alcohol induced violence, so it has been offset. But our experience is a little different, because I was just talking myself to a couple of women, because the 24 hours helpline which we have, we take turns in the night to be awake, because because people can't be like the same person can't be. So when I was talking to a couple of people, and one woman said that actually it is alcohol induced, and it is not because of the availability, it is because of the withdrawal symptoms, because alcohol is not available, because he is not able to go out, and as a result his abuse and violence has increased. So these were some of the things which we have really learned, and constantly there has been a conversation that how government should include support services for women domestic violence survivors under the category of essential services. That's one. And then so then coming down to what we have been trying to do, given the situation. So what we have done is that, of course, our teams in the districts are keeping a track, following up with the hospitals. We have really used this time to do a lot of capacity building of our teams who are working from home now. So we've organized a lot of online trainings to do outreach program, a lot of perspective building. We are doing a lot of dialogues on COVID and domestic violence. So these things, this is what we have been doing. The other what we have done is that we are using this time to basically expand our 24 hours helpline. We have partnered, because one of our donor, they have actually brought their different partners under one umbrella, and they have said that since PCPC already has a 24 hours helpline, why can't we network it to different states in India? So that consortium is being formed, and we are trying to make this helpline multilingual, because we know that post this or before this it's going to increase, or people will be calling more. Recently also we organized like a Zoom conference with different stakeholders, just to try to understand what are their issues, what are their challenges. Another thing which we have been doing is that in the last almost 1 month, we've tried to actually connect with almost like 200, 250 of our old clients, because we know that they have a history of violence, and calling them and asking them how they are doing, what is it they need, and especially in terms of grocery or anything, we have been like, connecting them, or we have been supplying. And and we have got the permission that where they can come to our office and collect. The other is, I think and of course our team. Tanya, I know my time is getting over. So yeah. The other is that I think in terms of our team has shared a lot of interesting example. That one of the team members said that my brother is working from home, I'm working from home, but his work is given a lot of priority, but mine is like I'm expected to help my mother in the kitchen or come there for lunch. But it is so different when men are working from home and women are working from home. So these have been like some very interesting experiences. The last in the least which I want to share is that tomorrow actually we are doing like a 6 months planning with 3 assumptions in mind, irrespective of lockdown, irrespective of this. And the 3 assumptions are: COVID will be there, domestic violence will be there and it will increase, and we are going to be there. We will be providing services. So with these 3 assumptions in mind, tomorrow our team is getting together and we want to plan that, okay, what is going to be that new normal? Because we are constantly saying life will be normal, life will be normal, but we are looking at, okay, what that new normal is going to look like. So after sharing this, I feel that, when we say that, yes, and we are 100% women's organization. And I feel that, yes, it makes a perfect case when we say it really matters when women are in leadership role. And I think it is required.
Thank you so much, Rashmi. Thank you for being here. Colleagues, thank you again for joining us and sharing your insights. We really are very proud to be working with such a dedicated group of individuals and organizations. And we have been in touch really with all our current grantees and plan to remain engaged so we can further understand your needs, try to better address them and support each other in finding solutions. And with that, I will turn to my colleague Shruti, who is the Monitoring and Evaluation Specialist for the UN Trust Fund. And Shruti will share our broader analysis based on the responses that we have received from each of our grantees. Shruti?
Many thanks, Tanya, and to our grantees for sharing. In the past 4 weeks, we heard from all our grantees, and in the next 20 minutes, I will be presenting our findings from a rapid assessment conducted by the Trust Fund of the global impact of the outbreak on CSOs and women's rights organizations funded by us. And I hope you can all see the presentation. Our objectives of the rapid assessment were 4-fold, and the presentation is really divided into these 4 sections as well. Assessing the impact of the outbreak on violence against women, assessing the impact on CSO operations and programming, assessing adaptations that have been made in the front lines to respond to the crisis, assessing the short and long-term needs going forward. The methodology used was as follows. On 19th March, we sent out 10 open-ended questions to 144 grantees, and you sent back 122 responses, 300 plus pages of qualitative data from 69 countries in 4 languages in the past 4 weeks. These were then translated, analyzed, and clustered by thematic. Just to note, this is a living analysis. Responses are still coming, and we intend to keep this as updated as possible. Diving right into the impact, our first finding is that grantees are reporting an alarming increase in violence against women and girls as a direct result of social isolation measures across all 5 regions that the Trust Fund operates in, and this is occurring in multiple forms. The most common form being IPV so far, and being primarily caused by stress and unemployment and all the different reasons that we heard from our grantees due to the quarantine measures. Several grantees also reported an increase in child abuse and exploitation, an example being from Nigeria, for instance, as a direct result of the stay-at-home orders. Sexual abuse is on the rise as well, as reported through our grantees that operate shelters and hotlines. Violence in humanitarian settings is on the rise. For instance, OWFI, operating a shelter and providing counseling to survivors of ISIS violence, reports a doubling of intake requests since the lockdown. Emotional and economic abuse as a direct result of food shortages, as Gaudens was explaining, particularly for women and girls and survivors with disabilities, who are being denied access to basic necessities within the household and community is rapidly increasing. And finally, femicides have increased, for instance, in Honduras, plus the militarization of daily life and an effort to enforce the lockdown and curfew has led to repression by law enforcement, particularly of women and girls who are leaving homes to fetch firewood and water for their families. A second finding is that there are multiple pathways through which risk factors for violence against women and girls have exacerbated and will increase the likelihood of violence very soon. And grantees have really drawn our attention to the compounded effect of all the pathways that I'm going to be talking about, because none of the following are occurring in isolation. These are co-occurring risk factors. Pathways include food shortages plus lockdowns, the lethal combination of which is increasing the risk of IPV and economic abuse and starvation. School closures and lockdowns, making girls more vulnerable to sexual harassment, exploitation, and child marriage. A complete cutoff or restricted access to some of the key institutions that grantees have beneficiaries in, for example, hospitals, custodial institutions, and quarantine centers, raises the risk of violence from male beneficiaries and staff in these institutions. And finally, suspended public transport and the lockdown implies that survivors are unable to get to essential services. Next slide. Even if survivors made it to essential services, the access to these are now completely disrupted in most parts of the world, particularly healthcare, justice, and social protection. For instance, in Egypt, we're hearing from our grantees that women and survivors living with HIV are struggling to access essential medical services and ARV drugs. In several countries, closed courts or arbitration only in urgent cases is impeding immediate judicial protection for survivors, for example, getting restraining orders. And finally, a lack of access to social protection at this time is particularly dangerous. As CBM points out, for instance, in Pakistan, the closing of the National ID Office inhibits women and girls with disabilities from enrolling in social protection schemes, which could keep them out of some of the entitlements that are to come. Given all of the above, we know now that violence is being reported not only through formal channels, shelters and services, but also via informal community-based structures and referral pathways set up and trained by grantees. Hence, relying on administrative data will not be enough, and listening to CSOs and this practitioner-based evidence grounded in the voices of survivors will be critical. Because as several of our grantees have pointed out in their national context, the issue of violence has not been prioritized in the COVID-19 response, and it is likely that many cases will remain invisible and underreported. When it comes to the impact on CSO programming and operations, grantees operate in 3 areas funded by the Trust Fund, and all 3 of them are impacted in different ways. If we talk about prevention, awareness raising and norm change interventions that typically use households, schools, women's economic empowerment, or communities as an entry point are all suspended or have to restart. One of the examples that's particularly sobering is from Nepal, where our grantee works with self-identified sex workers to provide alternative livelihoods. But now with the closing of the tourism sector, they have either gone back to their villages or gone underground, which increases their risk of violence or stigmatization. But it also means that our projects overnight have lost their primary beneficiaries. And this is the case for many projects. CSOs that train essential service providers and coordinate referral pathways are affected as well. For instance, our grantees from Philippines and Argentina are now no longer able to train their local government units and healthcare workers in survivor-centered approaches because the latter are now fully engaged and diverted for COVID-19 response and preparedness. And finally, CSOs that are pushing for progressive legislation are temporarily on hold as well. Our grantee from Malaysia, for instance, has been pushing for promised new legislation on sexual harassment and amendments to the labor laws, but parliament sittings are now postponed till mid-May, and this could lead to considerable lost momentum. And while some grantees have been able to adapt their programs to the virtual space, and we'll talk about that in a second, most of them cannot be moved online, either because the very design of their methodologies and programs thrive on face-to-face interaction and trust at the community level, or because grantees operate in remote rural communities with no internet or even electricity for that matter. In addition to programming, the pandemic and lockdown measures are putting considerable strain on organizations, their capacity and effectiveness. Their efforts are now focused on keeping their beneficiaries alive. CSO premises are being diverted for COVID-19 testing by local governments. Shelters and safe houses are struggling to procure food, maintain hygiene and healthcare. Frontline staff and women rights defenders are stretched and overwhelmed. There is now limited or disrupted communications between staff and with communities overnight. There is a loss of beneficiaries, a loss of momentum, and a reversal of gains. In some contexts, limited bank operations could shake up budget management, and there are constraints in fundraising as well. For instance, as our grantee from Malawi has pointed out, their local CSOs that rely on community contributions are struggling. Moreover, philanthropists that are trying to help locally are unable to reach places physically that need them the most. And finally, there are serious concerns about maintaining staff, consultants, and frontline workers, especially if the crisis continues for longer. When it comes to responding to the crisis in the front lines, grantees have shown an incredible amount of resilience in the past 4 weeks. And the following are 5 key actions that have been taken. First and foremost, grantees have prioritized the safety and health of staff and beneficiaries by moving and operating from home in accordance with national guidelines, undertaking surveys of staff needs, including internet access, space, furniture, childcare, and social psych needs. Prioritizing and reorganizing work into what is most important and can be done virtually, developing contingency plans and revising work plans within a framework of feminist care, and providing early payroll for staff to pre-purchase supplies and food and purchase internet devices to work from home. CSOs are maintaining existing shelters and services and opening new ones to manage the surge. In Liberia and Iraq, for instance, grantees are keeping their safe houses open while ensuring health protocols. In Serbia, a grantee, Atina, not only has kept their own safe house open, but also when the state-operated shelter ran out of food, they activated their reserve fund to support them. In Ethiopia established with a local implementing partner, AWSAD, established a new shelter in the center of Addis last week for 30 new women and girls who were previously in emergency accommodation at a police station with prisoners. CSOs are also expanding the reach of their existing services. Grantees are adding hotlines, and several are mobilizing psychologists and lawyers to provide consultations through Skype or mobile phones. They're hiring experts to develop protocols for virtual consultations in order to take into account the personal safety, privacy, and confidentiality risks of going online. CSOs are also adapting their prevention measures to the current context. Several are moving their trainings and awareness to the virtual space, WhatsApp, Skype, etc. Some grantees are working on income generation activities and shifting gears really to teach women how to sew protective masks and produce locally made hand sanitizers. Some grantees that train healthcare workers are also shifting gears and working to build the capacity of healthcare workers to incorporate a GBV lens to their COVID-19 response. And finally, CSOs are acting as a crucial nexus between survivors and governments during the pandemic, whether by generating networks with human rights organizations and ombudsmen to protect women, by relaying alerts from beneficiaries to national GBV coordination platforms, by joining coalitions to call for a progressive response to COVID-19, by preparing open letters to heads of state pushing for accessible dissemination of COVID-19 information, ensuring that local government support for COVID reaches at-risk women and girls, advocating for inclusion of beneficiaries in emergency food distribution by WFP, and integrating COVID sensitization within existing EVAW awareness activities like through local radios and accessible formats in different languages. It is worth noting that on all of these, in order to sustain these adaptations that grantees have made, there is need for additional resources. Moreover, for every grantee that has been able to make these adaptations and responses, there are at least 1 or 2 more that need funding to do the same set of activities, especially the smaller grassroots organizations. In addition to the above, the CSOs are also seeking resources, flexibility, and time for the following. CSOs are seeking funding for emergency needs, PPE, food, sanitation, and hygiene, sometimes as part of EVAW interventions and sometimes as standalone. CSOs are seeking funding for staff salaries, health insurance, communication, and self-care. And in the absence of these funds, sometimes grantees are reallocating from their self-care budgets, but this is also the time to sustain those self-care practices and coping mechanisms. CSOs are seeking flexibility to adjust project activities, timelines, and budgets. Project activities have to be modified considerably. Budgets have to be adjusted to match the increased cost of living, increased communication and transportation. Closing projects are seeking extensions to continue with the most vulnerable groups, for example, elderly women, so that the gains they have made so far are not lost. And once the lockdown is lifted, prevention projects expect heavier workload to refresh or restart, and services, as Rashmi just pointed out, expect a surge in referrals and intakes. CSOs are also seeking support to build internal capacity and access essential knowledge. They seek urgent investment in the skills to conduct rapid assessments, develop ethics and safety protocols, apply a gender lens in child safeguarding approaches to disaster preparedness and response. And most critically, they're very keen to learn from other grantees in other parts of the world dealing with similar issues at the exact same time. That concludes the findings, and I want to reiterate the key takeaways. Violence is on the rise and is likely to go underreported. CSOs and women's rights organizations are sending early warning signals. And in many contexts, they are the first responders to the daily changing nature of the work in their national contexts. But they are stretched and adapting with very minimal resources and need more sustained support and increased investment. I just want to end by saying that this assessment is a critical source of practitioner-led evidence and represents the voices of organizations on the front lines of the work to end violence against women in the context of the COVID-19 crisis. And we are immensely grateful for your time and generosity in sending us your responses in such testing times. Now that you've heard from the analysis, I'll pass over to my colleague Mildred Garcia, our operations manager, who will present our immediate responses.
Thank you, Shutri, for that presentation. This analysis presents indeed valuable information to understand what are the critical challenges and needs of the organizations and beneficiaries at this time of crisis and how this has affected the operational capacity of the organizations. So recognizing those challenges, the UN Trust Fund has put in place an immediate action plan that will help us to deliver targeted, responsive, adaptive, and flexible support to grantees and their projects during these unprecedented times. This action plan outlines 5 immediate steps that the UN Trust Fund is already working on. The first one, that we will acknowledge and approve delays in submissions of grantees reporting, including final evaluation reports. We are already making the necessary adjustments to our work plans and delivery accordingly. Second, we will exercise utmost flexibility in enabling grantees to modify or delay project activities while ensuring that grantees prioritize the safety, security, and well-being of their staff and beneficiaries. We are already working in adjusting our work plans and staffing accordingly to provide required support to grantees. Third, we will share resources and guidance to help grantees navigate this public health crisis. We will look back into the information that was collected from grantees and those experiences into a broader EVAW program and policy work. Fourth, we will accept for grantees organization to reallocate their funds between the budget lines to be able to meet certain core costs to ensure business continuity and minimize the negative impact of the COVID-19 on projects and institutional stability. And finally, we will approve no-cost extension requests for grantees to provide adequate time to wrap up or modify project activities disrupted as a result of this current crisis. All of these actions are necessary to ensure that the UN Trust Fund grantees remain viable, safe, and relevant throughout this crisis, and are able to deliver their projects to the best extent possible to address and end violence against women and girls within their context and community. And with that, I will turn to our colleague, Vesna Jaric, who is the Resource Mobilization and Advocacy Manager.
Thank you, Mildred, and greetings to everyone. So far, we have heard about impressive and restless efforts of women's organizations to respond to immediate needs of women and girls survivors of violence in their communities. UN Trust Fund community is built not only of women's organizations, but of a number of different and diverse partners who bring into this community different perspectives. In this session, we are aiming to unpack some challenges and opportunities in resourcing the work of ending violence against women of women's organizations around the world. And who is better placed than Hakima Abbas, co-executive director of Association of Women in Development, an umbrella feminist organization that for decades has conducted the analysis and advocacy around resourcing women's rights agenda and ending violence against women agenda to kick us off in this conversation. Hakima, please, over to you.
Thank you so much, Vesna. Well, let me start by saying, as the previous speakers have said, and maybe Shruti emphasized, we're really witnessing in stark terms what feminist movements have been saying for years, which is that gender-based violence, violence against women and girls increases in times of crisis, and that violence against women and girls, trans, intersex, and gender non-conforming people is intimately tied with militarization, authoritarianism, which institutionalize systems of violence and use gender as a form of control, but also economic policies, including privatization, austerity, that really strip social protections, undervalue care work, and other forms of unpaid labor. And I think, as Rashmi said, and the other speakers have proven, in uncertain times, there's perhaps only one certainty, and that's that when the world is in a mess, feminists and women's rights activists will mobilize. With whatever we have and however we can, that will happen. What I've been asked to do in the short time that I have is to talk about what funders can do at this time. I've only got a short time to do this, so you'll excuse me if it sounds a bit like a list of demands. But let me start by saying that I think that there's two aspects of funder responses that are important to hold. One is the immediate action to support emergency response and solidarity led by movements. And the second is reflection and action about long-term change on how movements are resourced, but also how the world needs to change, quite frankly. I want to emphasize that in some ways this is and I think we all feel it instinctively, this is potentially a catalytic moment for all of us, including for philanthropy. I had read that a woman called Dana Kawalki Chen of Justice Funders described it as philanthropy's matrix moment. Do you remember that moment in the Matrix? I really love the analogy with the red pill and the blue pill. So we can either go back after this moment to pretending, or we can wake up and really make the real changes that are needed. So what can funders do now? Some of the things that UNTF have been doing, for example, offer no cost extensions for all current grants immediately. You can't expect work to go on as usual from those on the front lines of community organizing for all the reasons that Shruti outlined. Expressly support grantees shifts to planned activities or objectives without penalty. Some groups are saying we're scared of how donors will react because we've declined activities, etc. And that's not how people should feel in this moment. There should be the openness for that flexibility. And of course, that leads us to, if you haven't done so already, make all grants core and flexible support, ideally multi-year. This current moment really underscores the absolute need for agility and self-defined strategies based in communities' own realities and contexts. With the cancellation or postponement of so many global convenings in 2020, what some funders can do is redirect your own travel and convening budgets towards feminist solidarity and creative forms of organizing. It's really not the moment to hold planned line items. It's the time to redirect boldly money, ideally on a large scale. And we would also urge funders to embrace the resources you do have and now. We know that there are real fears about endowments being slashed, about future funding being in jeopardy. But I read recently an open letter which had been written by some activists, and they said the strength of a funder's grantees at the end of this crisis will be a much better measure of the significance of a foundation than the size of its endowment. I think that really says it all. Walking the talk means taking risks and pushing past self-preservation to changing funding institutions and getting money out the door today. It's important to strengthen and expand and prioritize grants to communities most affected. I think we heard that from the speakers earlier, including movements led by women, girls, trans, intersex, and gender non-conforming people with disabilities, chronic illnesses, refugee and migrant women, LGBTI communities, and others who are really on the front lines of rights-based approaches to health, to care, and the economy. Specifically on GBV, funders can and should expressly support feminist movements mobilizing to address the intersections. I think it's really the moment to draw these connections. As you redirect your budgets, do consider emergency grants, new pooled funds with allied funders, or renewals of existing grantee partners. In all cases, consider application processes that are minimally burdensome and have the fastest possible turnaround. Of course, these are things that we would say in normal times, but they become even more important at this moment. Support the collective care and holistic security of partners, whether that's through additional grants or through core support, or even at the very minimum through solidarity statements. It's important to make clear to partners that grant monies can be used for psychosocial, physical, and digital wellness and care and security of staff and communities at this time. One thing that's, I think, crucial is to be honest about your own processes as funders. As quickly and transparently as possible, if you can share how you're adjusting and refining funding in response to the moment. The moment is really challenging and unpredictable for everyone. And as Aldiana said at the beginning of the call, it's unpredictable. But now's the time for all of us to model collective care, to support staff and partners, and to build in reflective space to reassess priorities like this call. As always, it's also important for funders to advocate with peer funders so that these steps are done throughout the funding ecosystem. As a last point, because I know I'm running out of time, I'd like to talk about policy coherence. Resourcing for social change has to be placed in the context of failing systems and the devastating environmental damage that has led us in part to this pandemic. It's important to remember that the majority world lives in crisis and catastrophe every day. Violence against women and girls in itself is a crisis. And we know the numbers. We know 137 women across the world are killed by their own family members every day. In Africa, 400,000 people die every year of malaria, a completely preventable and treatable disease. That's not normal. It's not because of innate poverty or powerlessness. And I think Rashmi was talking about the new normal. It shouldn't be considered normal, and it is because of patriarchal power, because of power asymmetries between countries and regions. It's because of destructive forces of global wealth accumulation, unfair debt and trade regimes, precarious labor, and the obliteration of social protections. But there are more just ways of relating to one another, of organizing, of distributing resources, of governing, and of social protection, many of which feminists are modeling. So let's not let this moment end in business as usual. Let's work in our institutions, and particularly funders, please work in your institutions to underline what's happening, to draw the real systemic lessons, and to be on the side of genuine change. As we address the impact of COVID-19, let's take the red pill. Let's see the world as it is and commit to changing it.
Thank you so much, Hakima, for your constructive suggestions and for ending your intervention on this call for solidarity. As a matter of fact, the UN Trust Fund community is the community of allies and the community of solidarity. In the preparation of today's meeting, we have received more requests from the governments to express their solidarity and share their thoughts on resourcing ending violence against women agenda than we could have accommodated. So I will give the floor to some of our long-standing partners and ask everyone to keep their intervention to 2 to 3 minutes due to the time constraint that we have on this call. And we will start with our long-standing partner, British Development Agency, David and Chloe Pratt. Over to you.
Thanks, Vesna, and hello to everyone dialed in today. So I'll try and keep this as brief as possible. So as many of you will know, and we've heard today, we face several challenges to resourcing work that focuses on ending violence against women as part of our crisis response. Too frequently, VOG is not prioritised as part of humanitarian response to crises. In terms of COVID-19, most people are focusing on the public health or primary impacts of the crisis. We need to point out that the so-called secondary impacts can be just as deadly as the disease itself, and we have to stress that VOG is a life-saving intervention. We know huge amounts of money will also be allocated by the international finance institutions to focus on the economic impacts of the crisis, and women should not be forgotten about in this context. Social protection programs will be one way in which donors try to mitigate some of the economic impacts on the poorest people, but we know that they have to be gender responsive to empower women and obviously reduce VOG. From our humanitarian work, we know the importance of taking a no regrets approach, and we should assume that VOG is occurring and take action to prevent, respond and mitigate, including as a life-saving measure from the earliest stages of the response. We should also be planning for a recovery now too. And we would really look to you to help us to define what a build back better approach might look like on ending violence. With that being said, funding women's organisations creates huge opportunities for immediate relief, recovery and preparedness. And DFID are clear that the best way to respond to the rights and needs of women and girls during this crisis is to fund women's rights organisations. These are one of the best mechanisms to ensure women and girls are meaningfully involved in the pandemic response. Without them, the rights and needs of women are an afterthought or are forgotten about entirely. Women's rights organisations are also experts in ending VOG and are in the best position to innovate. Because from obviously what we've heard today, the emerging evidence, we know that violence is increasing, just as our usual ways to respond and prevent that violence may not now work in this current context, and we're very aware of that. As Hakima talked about as well, we also know that core and flexible funding is particularly important at this time. And we know that providing that institutional support to these organisations is important because supporting women's movements are the best way to achieve lasting change. So I'll wrap up there, but I would just like to say it has been fascinating learning and listening from you all today, and we want to thank you all who are on the front line and the real first responders during this pandemic. So thank you very much, and I'll stop there.
Thank you, Chloe, for your very honest insights and encouraging messages of solidarity. Lisa Mossberg, our partner in the Swedish Development Agency, will share with us her government's perspective on challenges and opportunities in resourcing ending violence against women agenda during these times. Lisa, over to you.
Now, yes?
Yes, we can hear you.
Good, thank you. Thank you so much, and hello everyone. Thank you so much to everyone at the UN Trust Fund for organizing this important dialogue, and thank you everyone for sharing your important insights. I think I will echo Chloe to a large extent, and I think that is good news because we are donors together. It's definitely difficult and challenging times. We've seen nothing like this before, but we do recognize the pattern. We know that all crises affect vulnerable people more, And we know that all crises also enhance the structural inequalities we already have all over in all societies. And just like we've heard so good examples from Bosnia, India, and Rwanda, we see this clear pattern that of increasing levels of violence against women and increasing demands on women's rights organizations, but worsening preconditions to act, which is a really challenging contradiction. We see increasing pressure on women human rights defenders as a result of a shrinking space that we had already before, suddenly got even worse. And of course, we have an overall situation where the impacts are all over society. It's clearly not only health or not only economics. So it's education and everywhere. So what do we do? The Swedish government has announced that our commitment to devote 1% of GDP to development cooperation remains, and we are proud to keep that standard also in difficult times. But our GDP is decreasing, obviously, just like everyone else. So it's good news and bad news. Sweden has done reallocations already within the development cooperation budget to ensure more funding to immediate humanitarian and health responses, and also to do immediate adjustments in the large education programs we are contributing to make sure they remain relevant for pupils that can't go to school and have new needs, also including health and SRHR in this situation. Sweden, pursuing a feminist foreign policy, we shall always highlight the need to keep a gender lens on everything, on response in all sectors, and you should expect that from a Swede on all levels, in your country or in global meetings. It's about integration, and I think it's worth stating that gender integration is as valid as ever, as is support to women's rights organizations as one of the really important means, and also, of course, drawing upon the knowledge of women's rights organizations. In our overall program, we're pushing for gender analysis, and we're pushing for sex and age disaggregated data and inclusion of all different kinds of stakeholders. In our targeted funding to support gender equality and prevent gender-based violence, what do we do? And I appreciate the request for us to be transparent and frank. So one side of it is no, we don't have suddenly more funds available. We have the same funds available, and we have to make the best use of the funds we have. That also means that, but the good news is that we have good partners and good partnerships that can make the funds work in a good way now. We stick with our partners, and we trust that our partners can adjust in this situation. Some activities cannot be realized, and some adjustments are done. And our role as a donor is very much to trust our partners to do these adjustments and to be flexible for best possible use of funds available. We know that this flexibility, as discussed here today, is especially important also for grassroots organizations and smaller women's rights organizations. And we do and recognize that the need for long-term core support is key in a situation like this, because that is what provides the necessary preconditions to stay relevant and also to be flexible in a situation like this. I'm afraid I'm already running out of time, but to summarize, we do see a lot of challenges. There are too many challenges in a situation like this. Less total funding available is one of them. Projectification, shrinking space. I think there's a major risk that we forget everything we learned about gender integration. That is a risk we live on. But we also see opportunities for the Swedish government, and for SIDA is a chance to now really put our feminist foreign policy at test and prove what we mean with that. We also have many opportunities to really work through the trustful and good partnerships we have, and to stay relevant based on our partners' expertise. We're learning so much by participating and hearing here today. The flexibility is an opportunity to challenge ourselves. We are a state authority, and it's not so easy to say, yes, you can report next year instead. But we need to challenge ourselves to see how far we can push that, because we see that it goes in many steps away. There are also opportunities for all of us to be innovative in this. I think we are already learning. And it was so nice also to hear about the different things everyone is doing so good already, moving over from phone calls to chat support and things like that. And that is the work we need to keep up, that good work.
Thank you so much, Lisa, for your frank and sobering intervention, and also for reassurance that women's rights organizations are in the center of your thoughts at this time, despite the challenging circumstances. Kathleen Flynn-Dapa, the acting director of Gender-Based Violence Unit in Global Affairs Canada, will share with us what is the thinking on the side of your government. Over to you, Kathleen.
Thank you very much. Let me begin by saying, as a new donor to the UN Trust Fund, that we're very grateful for the invitation to participate in this meeting. It's an opportunity that we've appreciated hearing directly from some of your grantees, and the analysis that you've presented on how COVID-19 is impacting this essential and life-saving work of grassroots organizations to address violence against women and girls. And on the line, I actually have the Deputy Director for the Gender-Based Violence and Child Protection team, and one of the Deputy Directors from our Gender Equality team, because what we're hearing today is so important for the work that Canada is doing, the feminist approach that we want to take to the work that we're doing. We're very much aware that it's exacerbating violence against women and girls. And as an organization that is a donor, it also has our diplomacy and our multilateral work, we are trying to leverage all of our opportunities so that we are advocating and we are also supporting this work. At home, from the outset of our investments to respond to COVID-19, we invested in women's shelters and sexual assault centers to ensure that they were adequately resourced and to respond to increasing GBV challenges within Canada posed by COVID-19. And most of our provinces declared this to be essential services. And one of the things that we're trying to do is advocate with our engagement at national and multilateral levels for others to adopt this good practice. We're also working with our development partners, with other donors, to understand better what's going on with our partners who are receiving grants from us, to ensure that prevention, risk, mitigation, and response is maintained and prioritized, and it's integrated into our humanitarian action. We are already funding through some of the more recent announcements for our COVID-19 response, specifically action related to sexual and reproductive health and rights and to sexual and gender-based violence. And we're committed to ensuring that grassroots organizations do have the resources required to respond. Our Women's Voice and Leadership program already is based on having flexibility, and what we're learning from those partners and reinforcing what Hakima said is that this is extremely important in terms of the ability to pivot and adapt and to respond. And our Canada Fund for Local Initiatives is also looking at how best to use that funding to support grassroots organizations. And of course, because we're leading the call to action on preventing GBV in emergencies, we really want to use that venue as well to make sure that other actors in the sector are also keeping this issue at the forefront. I want to say that we're really supportive of UNTF's approach to the COVID-19 and the immediate measures that you're taking. And I think some of the things that you're looking to plan for the future in terms of more targeted support, we're really pleased to hear that you've acted so quickly using the evidence that you've gathered from your grantees. Hakima, we are our program officers are having conversations with partners across our funding envelope around things like no-cost extensions and reprofiling things within budgets. This is really important, and I appreciate you saying that, you know, people are scared of how they'll react to those requests. I would say if people are grantees with Canada, please go to your program officer and ask for those things and have those conversations. We're very much aware of the challenges and want to be supportive. And I just want to conclude by saying, you know, again, how much we've appreciated listening to the perspectives that you have. Part of our interest in joining this is to hear directly from women's rights organizations and grassroots organizations. Our gender equality team is doing scans and analysis across a number of sectors, not just on gender-based violence, but on unpaid care and on you know, frontline workers and food security and all these issues that are going to impact, in particular, women and girls and other marginalized populations, to really understand how we shape our response using a feminist approach. So thank you very much for this opportunity. We are using every opportunity that we have to learn new information to ensure that we are including these in briefings that go up to the minister, so that every time, 3 times a week, we brief the minister on what's happening around the world, and there's always a section on the gender equality implications. So this participation and what's been shared with us today is extremely valuable, and I thank you very much.
Thank you, Kathleen, very much for presenting your restless work on your side in keeping the focus on women's rights and gender equality agenda, and more specifically on gender-based violence. And thank you for reacting also positively to the plans presented by the UN Trust Fund and information shared so far by the women's organizations in this call. The next speaker that will address us is Anne-Marie Rendrick, a representative from a long-standing supporter of the UN Trust Fund Australian government. Floor to you, Anne-Marie.
Thank you very much, and good evening to you all. I'd like to extend my sincere thanks on behalf also of Australia's Ambassador for Gender Equality for this really valuable opportunity to exchange information, in particular to CSOs for sharing their stories, which do indeed demonstrate their resilience in the face of this pandemic. We are, of course, aware that violence against women and girls has intensified worldwide since the outbreak started. Health and financial pressures and lockdown requirements exacerbate gender inequalities and increase risks to women and children. Failure to respond now could see significant backsliding in gender equality gains, with long-term development and recovery consequences. We therefore welcome the Secretary General's call for a domestic violence ceasefire and measures to address this surge in violence against women and girls. Urgent and specific measures are required. A coordinated approach across justice, policing, and the provision of physical, psychosocial, and sexual and reproductive health services will, of course, be essential for women and girls' safety and well-being. Civil society organizations, and in particular women's rights organizations, such as the Trust Fund grantees, have quickly adapted. And we really see them as essential for the provision of life-saving services and for advocating for women's leadership and voice in the response to COVID-19. We understand that women's rights organizations are facing immense pressures. Therefore, supporting women's organizations to continue delivering essential services and advocacy in a manner that is practical, relevant, safe, and efficient must be an integral part of our COVID-19 response. Australia's response to the crisis recognizes the importance of working with women's rights organizations to urgently address violence against women and girls. And domestically, we have provided an additional 150 million Australian dollars to assist critical frontline services for women experiencing violence throughout the pandemic. Internationally, through our aid program, we are bolstering our analysis and our development partnerships to address and prevent violence against women and girls in the Indo-Pacific region, and to ensure that services remain available, accessible, and safe for women and children. And we commend the UN agencies and the UN Trust Fund for all these ongoing efforts to address violence against women and girls. And we welcome very much the opportunity to explore further how we can effectively support women's organizations in addressing violence against women and girls during our response to COVID-19. Thank you very much.
Thank you, Anne-Marie, and thank you for the encouraging news on additional funding in response to the crisis. And thank you also for bringing up the call for action of the UN Secretary General to address domestic violence during COVID-19 crisis, which has been endorsed by 137 countries so far, which leaves space for hope. Last but not the least is our partner, Kieran from DFA, the Development Agency of Ireland, and floor to you, Kieran.
Thank you very much. So I'd like to thank the Trust Fund for the opportunity to speak today. In terms of the challenges of resourcing work on the elimination of violence against women, speaking on the COVID-19 crisis in broad terms, it is vital that we act in a coordinated way in response to this global threat. A central message of Ireland's response to COVID-19 is that we are all in this together, and that is as true globally as it is locally. Collective and coordinated action through the United Nations and other global mechanisms will be a major focus of Ireland's political and financial response. We need to use existing mechanisms, whether for coordination or flow of funds, to their greatest effect and harness country-level UN assets in a coordinated and coherent manner. These efforts should maximize agency comparative advantage, align with government priorities and capacities, and ensure a focus on leaving no one behind in the COVID-19 response. How the UN Trust Fund for the Elimination of Violence Against Women's work alongside and in collaboration with sister agencies will be critical for a coherent and impactful response. Gender equality is a priority for Ireland's international development cooperation, and we're working to ensure that there is an overarching focus on women and girls as part of our COVID-19 response. Resourcing the work of women's organizations is an opportunity to support the voice of women and girls, their voices being essential to understanding the impact of the epidemic and effectively meeting the needs of affected populations. Supporting the agenda for the elimination of violence against women enables women's involvement in decision-making on outbreak preparedness and response. It ensures women's representation in national and local level COVID-19 policy-making spaces. Women's voices are also essential to safeguard healthcare workers. Up to 70% of frontline workers in health and social care are female. Their needs must be integrated into global and national response efforts. It is essential to ensure continuity in the provision of support to women's rights organizations, as well as flexibility regarding ways of working to ensure that women's organizations are able to sustain their operations in these challenging circumstances. We note that given women's organizations' frontline interaction with communities and their participation in the delivery of community services, their staff potentially face a higher risk of exposure to infection. Local women's organizations are crucial to highlighting the need to maintain uninterrupted access to sexual and reproductive health. Evidence from past epidemics, including the Ebola and Zika crises, indicates that efforts to contain outbreaks often divert resources from routine health services, including pre- and postnatal health care, exacerbating often already limited access. Supporting local women's organizations will ensure that proper attention is given to sexual and reproductive health and rights during COVID-19 to ensure continued provision of essential services to women and girls. With evidence demonstrating that pandemics compound existing gender inequalities and vulnerabilities, increasing risks of violence against women and girls and other vulnerable populations, partnering with the Trust Fund for the Elimination of Violence Against Women is a valuable means of directly supporting grassroots organizations. I just want to thank you again for the opportunity to share these remarks, and I'm grateful for the organizations taking part for this hugely valuable insight into the practical issues they're facing. Thank you.
Thank you very much, Kiran, for your intervention, and with thanks to all of our speakers for bringing your valuable insights and sharing information with the community of the UN Trust Fund. I pass the floor now to my colleague Gemma Wood, who will be moderating an open discussion and open contributions. Floor to you, Gemma. Thank you.
Hi, everyone. Thank you very much to Vesna, to all of the speakers. We've now reached the open discussion section. We have about 20 minutes. The open discussion session, we're going to try and focus on contributions to the discussion from a range of partners. We've received some discussion points by email, which I will focus on first. Unfortunately, we regret that we'll only be able to do this in English, but we will, as Tanya said, have sessions in French and Spanish later on this week. When you make an intervention, we'd be grateful if you could provide your full name, the organization that you work for, and remind us of the type of organization, whether you're a UN Trust Fund grantee, a partner, or a donor. And we ask you to focus on questions that add, or discussion points that add to the discussion amongst us, rather than questions specific to UN Trust Fund procedures. We very much hope that we've answered some of your questions already to say how the UN Trust Fund will respond. So specific questions or project modifications, budget allocations, we will answer immediately directly to specific grantees after this session. So I will be in a moment closing my slides and moving to the chat. We ask that you raise your hand by using the little hand option on the chat box. And as I mentioned, do remind me of your name and organization. And this is just a reminder on the screen of how to raise your hand. We have a lot of people online. We have 242. So as I said, we may not get to all of you. And I think we have about 240 or so comments. We did have a range of discussion questions posed, but we'll just have to see what we get to. But it's amazing to see the amount of discussion and dialogue and solidarity there is among this. So this conversation could continue. So first of all, I want to turn to Abby. Abby Sefu is from Liberia, who works for Episcopal Relief Foundation, for Episcopal Relief and Development in Liberia. And Abby has some great reflections on the time in Liberia when there was the Ebola crisis, which is highly relevant. So I would ask, I think Anna is going to help unmute Abby. And I will leave the floor to Abby. I'll leave you, you'll each get about 2 minutes for an intervention, and I'll let you know when that's over.
Okay, thank you for Gemma. Can you hear me?
Yes, very well. Thank you, Abby.
Yes, so I just wanted to share our experiences in working on the Ebola crisis. You know, that was in West Africa. So like the coronavirus, I think it took us also by surprise in how rapidly things started to unfold. So, I mean, first and foremost, it was developing an Ebola response strategy. So, by the way, I'm from Episcopal Relief and Development, and I'm Senior Program Officer and lead for our West African countries. So having said this, our response strategy was developed first and foremost. So the strategy was the combined use of existing development and church assets, operational projects, parishes and churches to accelerate wider reach in covering major towns, you know, in hard to reach areas. That was the first strategy. And then it was engaging faith networks and the leaders to influence change in behaviors and practices, because we know the potential capacities of faith leaders. They can build, it's building upon the trust and confidence that they already have in their respective communities. And then it's the identifying and influence the key influencers and change makers. So basically these are women faith leaders and others. And then it's about building up on what already exists. There was a wide and vibrant volunteer network that was used. This consists of priests, imams, you know, like, or saving and loan women leaders. So just for for time purposes, so the first thing first, it was allowing for a certain level of flexibility in adjusting plans for ongoing projects. Remember, we had the Violence Against Women and Girls program, which was already upstarting. This involved engaging faith leaders to speak out against violence against women and girls. And then we had an integrated food security program. So first and foremost, it was about identifying or doing a rapid mapping exercise on who's who and who are the change makers that can be used. And then it was about identifying the key activities that can be deferred or postponed. And most importantly, it was also about identifying key activities that can still continue and can be used to intensify the Ebola response and prevention work. So for example, faith leaders were normally speaking out against violence against women. That was one of our key activities in normal times, but it was adding on another layer, enabling them to use scripture to reinforce key messages on Ebola. So it's about awareness, reducing stigma, and restoring hope through radio broadcasts, obviously. And then, interestingly, it was the use of women and saving, or women saving and loan groups. Here, I think you understand that entire villages are quarantined. So basically, there is a livelihood issue involved. So there was a certain level of flexibility where participating groups were given the decision-making, responsibility. So each saving group can opt for dispersing the savings that they already have, or use whatever group savings they have to use it to buy consumables, or even help out their other, neighbors, or even in some cases assist the health center, giving
Thank you very much. Thank you very much, Abby. There were some really useful reflections. I'm very, very sorry to cut you off, but as I said, I really hope that we'll be able to continue this dialogue, especially with organizations like yourselves that have dealt with this already on the front line. So thank you very much. So now we heard a cross range of organizations, and in particular, we heard from Rwanda on the case of women and girls with disabilities. So now I want to touch on that issue again, this challenge of reaching the most vulnerable, by asking Dorothy from ADD International in Cambodia. I think you wanted to make an intervention. Thank you.
Thank you.
Go ahead.
Hello, can you hear me?
Yes, we can.
Hello, thank you very much for giving me the space to intervene. First of all, I'd like to thank the UNTF for supporting us to reaching out to the unreached at the community level, and for signaling that we can reschedule our work or restructure our work to ensure that first and foremost, our most vulnerable beneficiary, primary beneficiary, at least stay alive as the first stage. At the second stage, we need to look into how they can access to the basic kit, survival kits, such as basic food supply, rice, commodity, and sanitation commodity, so that they can at least be continue to survive within the community. And the third aspect is for them to be given access to the right services that they deserve. And even under such difficult condition, such as the pandemic, their voice and their need will be very, very difficult to be met. So it's very important that we are allowed to redirect our resources and our fund under the UN Trust Fund to reach out those people in collaboration with our grassroots organization and self-help organization. And this is perfectly in line with ADD international strategy, which we are making effort to contain as much as we can the response to the COVID-19, which is first and foremost accessing to livelihood for people with disability, and secondly, making sure they access to medical support, and thirdly, they access to the necessary social support in situations whereby they risk to be further marginalized. And lastly, to be able to access to accurate and relevant information that concerns them and that protect their life. And this is extremely important in context whereby we are facing some U-turn in democratization. And as some colleagues from your donor side has put it very clearly, we are facing in the region a situation of shrinking space. So the plight of the poor, the vulnerable, and especially the women and girls with disability would be even harder hit than you can ever imagine. So reinventing or realignment of our activity to really match the need of those people is really of crucial importance. So I would like to end my presentation with a metaphor. They used to be facing double jeopardy, but now with COVID-19, it's becoming a quadruple jeopardy. On the one side, they are disabled. On the other side, there are women and children that are marginalized. On the third side, they are sometimes not accessing the right level of information and service. And now COVID is further aggravating their situation. I'd like to end here, and thank you very much for giving me the floor.
Thank you,
Much
Bharati.
appreciated.
And we know that ADD International shared a guidance note, a briefing on how they're integrating COVID response into your work with women and girls with disabilities, which we'll share. So now I want to go to Ana Falu from Argentina. Ana, could you give your name, your organization? Thank you.
Okay. Thank you very much. Thank you very much for this opportunity. It is extremely important to hear and to learn from all the speakers in this meeting. I think that is, we are in the middle of a tremendous pandemic. And well, I'm talking from Argentina, Cordoba. My name is Ana Falu. I am the director of an NGO working on women's rights and from a feminist approach. We firmly believe in what Hakima said in her presentation, that we need to strengthen and enhance solidarity and the collective action and community-based networks. Our project is an urban project. We are focusing on violence on the public spaces. And as we all know, this pandemic is manifesting with virulence in cities and in the big urban agglomerations. And in Latin America, particularly the region from where I'm speaking, these cities are characterized by obscene inequalities. As Boriti from Cambodia just said, there are large poor territories that appear as a parallel world of very rich territories, and with a degraded habitat, with lack of services. And in order to stay within the house, within the home, as we have as a very good order from the government, a strict lockdown, you need to have a house. And not all the people have a house. That is in the first place. And also to wash your hands, you need to have a tap with water to wash your hands frequently. So this is a very critical situation for the Latin American cities, and particularly for women that are the caretakers. Women are the ones taking care of the children, of the elderly, of the handicapped, etc. So that is the first point. And the second point we want to share with you is that in our cities, where we focus our action, there is a silence. Now we have very silent cities. And then we think that the silent city can listen the voices of the violence. And we are trying to work on that, yeah? So the first thing is a high level of uncertainty. And this lockdown is putting into a considerable strain our organizations. There is a health and an economic crisis. And that, thus, the government that are our partners for our trust fund implementation will not be able to contribute. This is a point we want to share with you.
Thank you so much.
We are worried about that, yeah? And also, I want to close with this. We are very worried about the short time, but also the long time. We need to restructure our project, yeah? And the activities that we need to do. And the last point I want to share, because I'm sure it's a point of all of us, is the reproductive and productive work within our houses, and we are doing homework. So this is another constraint we are facing in our activities. Thank you
so
very much to all of you.
Thank you. So now we only have 5 minutes left, but just to get to say if there's been a lot of questions in the chat box, so we're going to copy and paste all of these. We're going to try and use our network. We are a network together in solidarity to find a mechanism through which we can share these questions and have answers coming back from people. In some cases, there aren't answers yet. This is something that we have to work on together. For example, I am myself from Ivory Coast. He sent in a question in French about stress levels and how obviously there's such a heightened level of stress in homes. So how are we all dealing with that as a risk factor and a cause? There's a lot of questions online about how we use online platforms safely. So we're going to copy and paste all of these. We're going to try and facilitate a conversation across our grantees. But now with only 4 minutes left, I want to pass back to Aldiana just to check in as you were going to close the session.
Thank you so much, Gemma. And let me start by saying big thank you to everybody for today, for participating. And I see this as a beginning of the conversation. Unfortunately, we are at the beginning of this situation and there is a lot that we need to do. We've heard a lot today about many. Gemma just summarized some of the things we heard, and we've seen from Shruti's presentation. We heard from donors, we heard from all of you. We heard about particular challenges of violence of women with disabilities, refugees, indigenous communities. We heard about the regress in prevention work, new context in hospitals, police, justice system, homes. And I want to just put the spotlight on something that Hakima said. She says it's a time for taking the risks. And I totally understand what she means when she refers that to the donors particularly. But I would like to put that taking the risk versus something that I have heard from all of you, from your surveys as well as today, which is basically that what I see, I don't see much risk here. I see here first responders know exactly what they're doing. And, and that is because pandemic of violence against women has been here for a long time. This time might be unpredictable and they might be new, and the coronavirus is something new we are facing and the situations of the lockdown is new. But what I've heard for the day is a wealth of responses by all of you and adjustments and modifications that are happening because you know what you're doing. You know how to adjust, what kind of thing you need to do to support your beneficiaries and survivors. So I think, while yes, I understand we need to take some risks, I also think we have to be aware that first responders know what they're doing, particularly small women's organizations that are working with women with disabilities, with marginalized women. They're already there for a long time. And so I think what we need to do is to come together really and stay together in this situation and share our experiences, particularly those examples that come from the South. of good practices and best practices. And I can promise for the Trust Fund, we will try to do that. In terms of what we will be doing, we will try to we will continue this assessment and gathering of information so that we can inform our own procedures and our own steps much better. We will continue to share the solutions. We will consider organizing another meeting like this, maybe in 6 weeks' time or so that we can follow up on what we've heard today. We will also look at how do we better inform different language groups in terms of how can we stay better connected with colleagues who are speaking different languages rather than English, or how do we perhaps get that famous software that there is out there that you can hear everything translated into your language. But what we need, apart from coming together, I think we need to provide specific and targeted support, and that goes for all of us, particularly for the donors. We've heard a lot today about what kind of support that is. And to that effect, that the Trust Fund will open a new COVID-19 call for proposal pending funding we received this year. It will be later in this year that we will launch this call with a focus on projects specifically dealing with the issue of violence against women as a consequence of the COVID context. In our new strategy, we will also take the COVID-19 into the consideration. James Lang, I see he's online, who will be working with us on this strategy, has heard everything today, and we will have a lot of discussions. We will be reviewing our business model. We are doing it already. Artan Alko, who is also online, is helping us to look at our business model and what that means in terms of some of our operational and financial ways in which we are distributing grants and how are we working. And we will certainly continue our advocacies for the core support for women's organizations that is so much needed. Those of you who were at the convention in Bosnia know that we are very much advocates for support of the core. So I have not much else to say to all of you, but just a really big thank you. And, you know, I hope I will see you again in person, but even this was good to touch the base and see all of you. I want to say thank you to my team who has helped prepare all of this, to all of the presenters, speakers from civil society and governments, and just stay safe. Keep, you know, the health is first, you and your families come first, and stay in touch. We will definitely be in touch with you. And thank you so much, everybody, for today. I really appreciate it. Thank you.